Good afternoon, everyone. I'm here to share our learnings and experience on leveraging and institutionalization of community-led multi-sector integrated interventions to improve food, nutrition, health, and WASH outcomes of girls and women through DAY and RLM platforms. To give a brief background, Swabhiman program is being implemented by DAY and RLM with support of UNICEF in 3 Indian states, Bihar, Chhattisgarh, and Odisha. It is a multi-sector intervention provided in response to the poorest of the poor communities, delivering essential 18 nutrition interventions, moving away from mere nutrition counseling or provision of income security. It's an integrated multi-sector strategy that is being tested to improve girls' and women's nutrition via federations of women agencies using a micro-planning based approach. Over the 2 years of implementation, the impact evaluation was and the midline results have been promising. It has showed that there has been an improvement in the coverage and access of essential 18 nutrition intervention, and at the same time it has showed which are the actions that are helping to reach us to the intended outcomes, what are the actions that are working on the field, what are not working, or what are the actions that can be scaled up across these other NRLM blocks. This evaluation has helped DNRLM to get informed on what are the interventions around FNSW that can be scaled up. Hence, from 5 initial evaluation blocks, certain interventions from this program has been even scaled up to more than 22 blocks across these 3 states, covering about more than 150 higher ordered women federations. However, to support the scale-up of these interventions, there is a requirement for an institutionalized approach to support operational strategy development, annual action plans, at the same time providing repositories of tested tools, trainers, and manpower at the state level. Swabhiman program has helped to even establish the institutional architecture for this for scaling up of certain the FNSW interventions. It has the institutional architectures have been able to learn from the sites and provide systematic and technical assistance and hand-holding support for FNSW interventions, at the same time ensuring the continuity of relearning in the evaluation sites. Technical assistance include operational guidelines, program implementation plans, budgets, at the same time provision of capacity building inputs through tested repositories, trained community resource persons that are mapped across the states that are already implementing these interventions, provision of standard indicators to ensure process monitoring and establishment of MIS, and also providing a space for testing and adding new interventions and approaches. Through this implementation learning, we have found that programs with nested evaluation provide the impetus for learning. At the same time, it is very important to have local government institutions as an anchorage and support to the programs. It is equally important to learn what does work and what does not work in a programmatic context. And it provides, there's always a need to integrate innovations, and evaluation sites provide that ground. Through the process of this implementation, we learn that there's a need to integrate and institutionalize community-led planning for FNSW related outcomes, and at the same time to focus on the centrality of adolescent girls groups to be formed and tagged to women federations of women DNRLM, while government institutions continue to provide support to government programs. And this process has helped us to understand and provide a know-how as to how livelihood missions can be made nutri-sensitive, and also how livelihood missions can support in further development and integration into the convergent action plans of POSHAN. Thank you.